because the session is on the cataract surgery, and we have none other than Dr. Zain Khatib, who is a top guy from Bombay. And Zain is a very, very dynamic, prolific cataract surgeon, refractive surgeon also, and he's going to do a Vivinex toric Hoya using a Stellaris Elite machine. He has already marked the patient. He has used the Patwardhan app, Saurabh Patwardhan app to mark, to find out whether the mark is okay. How is the 3D transmission now? Hello?
It's now very good, sir.
Very good.
Shall we proceed with the case?
Yeah,
Yes,
you can, sir.
Okay, over to Zain. Zain,
Yes, sir.
all yours.
Thank you, sir. Good morning, everyone. Am I audible?
Is he audible?
Very much audible, sir. Please continue. In case it's not audible, I'll keep talking.
Yeah, fine.
These marks are at 0 and 180, and using the Patwardhan app, this is a with the rule astigmatism. So I have got an axis of 102. I'm going to be marking with a Sinskey hook at 102. So this is the axis of placement. Okay, I prefer marking with the Sinskey, put saline. Prefer marking with Sinskey so that, there's no parallax error. I'm going to be operating, no, give me the keratome. And I want MVR. Yeah. Okay, so this is a 2.8 millimeter incision I'm going to do, and I'm going to be operating on the Stellaris Elite machine. This is a limbal incision. Slightly superotemporal. Out of focus, okay. Focus. Better? Okay.
Ravi Shankar, please let me know. Please talk over the mic from that side, otherwise we will not know whether people are...
Sir, don't worry, sir. You're very much audible.
No,
the audio, sir, video is also very clear. We are
focused now very nicely.
Sir, how much is the toric component in this case?
So this is T4 toric length. This is a T4 toric length. And the axis of placement is...
Dr. Zain, you didn't mark the incision.
1.50.
Incision.
1.50. 1, 2. So he is sitting at the head end of the patient, superiorly, not temporal. He is sitting at the, and he has made a main incision, and then he is using a Uttrata forceps.
Yeah, so this is a Haldipurkar forceps.
Haldipurkar forceps.
Dr. Zain, you have not marked the incision site. Is there any specific reason for that?
Yeah, because I take my SI to be 0 in all cases. Incision doesn't matter to me for my toric outcomes.
Okay.
So I take it as 0. So I have that ergonomic benefit that I can do it wherever I want. I usually do all my incisions superotemporal.
Superotemporal.
Okay.
Okay, so this is a 4.5 to 5 millimeter capsule.
Beautiful rexes, beautiful rexes. So he used just the Haldipurkar forceps and pinched and did the rexes. I call this pinchorhexis. For mature cataract is panchorhexis, immature cataract is pinchorhexis. He's doing a hydrodissection. You can see the wave nicely.
Vispo. Dialer.
No hydrodelineation, no?
No, sir.
Okay, no hydrodelineation.
Sir, Vivinex toric goes through a 2.2 incision. Why did we choose 2.8 here?
Doesn't matter, because sometimes whatever you are comfortable, you can do it.
I agree with you, sir.
Yes. Whatever you are comfortable.
Yes, sir.
Of course, Vivinex toric, but other lenses, they go through 2.2 as well. But the problem is sometimes you stretch the wound. It's better to always enlarge the incision, put the wound,
Yes,
put the lens.
Yeah.
So he's using a Stellaris Elite mission, and I want to talk a little about the Stellaris Elite mission. You want to expose the tip a little, Zain? Is it okay?
Yeah.
This is a 15-degree tip. As you know, Stellaris Elite mission is a workhorse.
Can put continuous.
And if somebody can show the yeah,
It's on.
camera on the Stellaris Elite mission, external camera. So, beautifully done, very nice focus. And the Stellaris Elite mission has got adaptive fluidics. And if you show the mission camera, you know the yes. You can see the mission, and this is a true
No, we
Venturi
don't see.
system. It's got fantastic features. It's got hyper pulse. It's got custom control software similar to the White Star. So he's doing a direct chop there, and you can see here beautifully he's chopping. He's holding the thing, and he is using a pulse, hyper pulse there, using high vacuum.
Beautiful choice.
Very nice chop is done. Which chopper you are using, boss?
So this is a C-bell chopper.
C-bell chopper.
It's like a butter knife for vertical chopping.
Okay.
So it is not sharp, but at the same time it does a very good vertical chop.
Why you are not using my chopper, Zain? Next time you will not be allowed into Rajan.
Saline.
Anyway, he's doing a fantastic job there. He saw that how he's using his left hand to chop the pieces. The
He's
most
a-
important thing is the holdability with the vacuum, and he's beautifully done it.
So now I am using the yaw part of the Stellaris machine.
Yes.
Where I can move my leg from left to right to get more vacuum.
Yeah. See, the advantage of the Stellaris Elite mission is that there is a yaw. On the right side, if you move the foot switch on the right side and go down, simultaneously you can increase the phaco power, the number of pulses, the vacuum as well. It's called dual linear.
Dual linear.
Yeah, it is there in the Galaxy Leo also. Just to tell you that the Appasamy missions are also fantastic, and they have got all the features as well. So now he's got the epinucleus.
This is done in the
One
epinucleus
piece of
mode,
nucleus
sir.
is there.
I need little more chamber stability.
Chamber stability.
Yeah, good
Okay.
saline.
Reduce the vacuum a little. As you know, this is a Venturi system, so it is a vacuum based system. So you need to adjust only the vacuum and not, because you cannot adjust the aspiration flow rate unlike the peristaltic. So he's done a fantastic job. Give a big round of
Very
applause for
beautiful
Zain.
done.
Excellent.
Beautiful.
He actually
Within
very,
no time the cataract disappeared.
he very smartly did one
And
technique.
now he is using are you going to use
Yes,
bimanual?
the bimanual.
Bimanual.
Very good
All the
maneuver
surgeons
and a
use
mid-dilated
bimanual.
pupil.
Old surgeons like me are lazy, they use coaxial.
Continuous irrigation.
So bimanual, yeah, which bimanual are you using? Our-
This is the Stellaris Bosch and Lomb bimanual.
Oh, you got it with you?
Achha, this is my.
Ah, okay, fine. Very nice. Always, of course, bimanual, remove the subincisional cortex, but it doesn't make a difference in bimanual.
It's preloaded. Keep it ready. Lens ready.
So he's going to interchange now. Irrigation on the right side, aspiration on the left side. That's the advantage of bimanual. You can have a 360-degree coverage of all the fornices of the capsular bag. You can see beautifully how he is engaging the anterior end of the cortical fiber, which is underneath the Capsulorhexis margin, and not to catch the posterior end. Very beautifully he is doing that. It's a perfect copybook style of cortex removal, which is very important because
Just give me a hydration. So I like to polish the posterior
so
capsule.
he is doing what is called power wash. Power wash, Sujata does it regularly.
Okay,
and
focus is-
remove all the epithelial cells from the posterior capsule. Focus a little, ma.
Better? Okay.
Better now, yes. I hope the 3D demonstration is good there in the hall.
Yes, sir. Yes.
It needs a little bit focusing.
Yeah, because the chamber is shallow now. Once he puts the visco, then it will become more focused.
Yes, sir.
Is that
Very good.
okay?
That's fine. Now he is going to put the Vivinex toric, and the Vivinex toric, as you all know, is one of the best lenses. And more importantly, I think the multi-cert injector. Can you zoom down a little, Zain? Yes, the multi-cert injector, in my opinion, I want to know the opinion of Zain also, is probably the best injector in the world. Best injector in the world. I'm sure you will watch for it. Yeah,
Oh,
ready,
it's ready, okay.
ready already.
Okay, okay.
Yeah, we
So,
make
yes,
everything
sir.
ready here, Rajan, don't worry.
Sir, I agree with you. The advantage of this injector system is that it's got both push and screw type.
Screw
As
type.
you can see here, this is the screw and this is the push type. So the surgeon can decide on their preference. And it's, as you said, sir, it's one of the smoothest injector systems that is there.
And you can go through very
You can go
comfortably through 1.8
0.2
also.
millimeter as well.
So as sir said, yes, you can go through 2.2 or 2.8. So since better. Okay, so since it is 2.8 now, I'm just going to do it single-handedly. Okay, and it will implant the lens directly into the back.
Into the
There was
back.
a slight push there. Just give me a dialer.
See, the one is as I told you, the biggest advantage is the multi-cert injector system of Hoya, which is actually made a huge difference. And it makes the life easy, not only for the surgeon, but also for the assistants. You don't have to load, you don't have to catch the optic, you don't have to be bothered about damage to the optic or the haptic or whatever it is. So I think it's very important, number one. Number two is, coming to the features of this Hoya toric lens. This Hoya lens, the Vivinex, is something which is incredible, I will tell you. And the glazed haptic, you can see the rough, can you show the haptic a little, Zain? Because
So,
pupil is a little small
this
there.
patient has a slightly floppy iris.
Floppy iris as well. Don't worry.
But it's got a textured haptic.
Textured haptic,
Texture,
yes.
which is very good for stability.
Yeah, good for stability. It prevents the PCO, prevents the negative dysphotopsia, and all these factors come into play. And these Hoya guys, they have done a lot of research on this, and they have come out probably the best technology as far as the lenses are concerned. And not only the Vivinex, but also the Nanex. Then we are using the Geometric Plus, the Impress, which is enhanced monofocal lens. Now I think they're coming with the Impress Toric as well, Raghu. Impress Toric is also coming. Geometric Toric Plus, everything is there, which I'm using very commonly.
Why hook? Why hook?
Why hook you want? Okay, you want to show that?
No, it's a small pupil. So,
So your toric, yes, toric. So you can see the toric mark, and it's coinciding with the 102, huh?
Keep the irrigation on.
102.
102, yes. Sir.
102 is very nice, very nicely done, beautiful demonstration. So how it's important when the pupil becomes small to use the Y rotator and go underneath and find out where exactly your toric lens is placed. The axis of placement is perfectly right. You're almost there, and maybe slightly to the right inferiorly. Yeah, this is okay. Huh? Yeah, 3D level irukku. Fine.
Yeah, this is aligned now.
Aligned,
with the
yeah.
marks that I had made.
The advantage of the bimanual is that you can move around the lens also, and you can even do what you call hydro implantation as well. That's a big advantage. So
It's a wonderful
I think the-
surgery
that's
with
the end of the
ill-sustained
surgery.
pupil, doctor.
I think we should all give a big round of applause for Zain Khatib for lovely demonstration, I would say. You made it look so easy and very easy. Zain, you'd like to say something before we close up?
Thank you, sir, for the opportunity. This was actually my first live surgery.
Very good.
And I'm
It didn't seem like that. It seemed like a pro.
As if you have done about 100 live surgeries, it's like that only.
I'm humbled that Mohan Rajan sir has invited me to Chennai to do this demonstration. I thoroughly enjoyed it. OT staff is thoroughly professional and it was a lot of fun.
Thank
so
you,
much.
thank you. Yeah, we believe in fun. We take fun seriously. Yeah.
Thank you, Dr. Zaid.
Okay, go over to the what do you call lectures, Ravi.
Thank you, sir, thank you. Panelists, you can take over and call the next speaker, please. And I also request the other speakers to be ready.
Let's all give a big round of applause to Zain.